Knock, knock, knock.
You can always call for backup.
Okay. Hi, my name is Rachel, and I'm going to be your student nurse today. Can you please state your full name and date of birth for me?
Joe Smith, 12/18/71.
Okay, Mr. Smith. I saw on your mark that you have no known allergies. Is that true?
Yes, that is correct.
Awesome. So what we're going to be doing today is we're just going to be changing your PICC line dressing. So before we begin, it's going to be important that you're able to follow commands. Do you think you'll have any problems with that today?
Nope.
Okay, perfect. So then what I'm going to do is I'm going to prepare my sterile field. So I'm just going to open this away from you. I'm going to put on my mask. Okay. So I'm going to put on my client's mask without turning my back to my sterile field, so just standing sideways. So, do you think you'll be able to wear a mask today?
Yep.
Okay. So we're going to just put a mask on you. Now, if my patient wasn't able to put on a mask, I would have him or her turn his or her head to this side, away from the PICC line dressing and stuff like that. So now what I'm going to do without crossing my sterile field is I'm going to grab my hand sanitizer. I am going to wash my hands. I'm going to put on some gloves.
Betty, have you ever had a blood transfusion before? She said she has not, so she does not know, and no reaction is she states that she has no known allergies.
Okay, now what I'm going to do is I'm just going to look at our site here. I'm going to grab this, and I'm going to measure 6 inches up from the insertion site. And then I'm going to measure the circumference of the arm. Now, it's really important to measure the circumference from the arm and compare it to baselines, because if it was off by even a half an inch, it could be a sign of a problem, like phlebitis or the catheter or the PICC not being in the right place, things like that. So it's important to measure that. Another thing that we're going to measure is we're going to measure from insertion site to the hub. Okay, and compare that to baseline as well. So before we take off the dressing, I'm just going to assess the site. Make sure there's no swelling, redness, edema, ecchymosis, drainage, and just the approximation if there was any wound of any sorts. It looks okay. Do you have any tenderness here when I touch on your arm?
Nope.
Okay, perfect. So now what we're going to do is we're just going to remove this dressing. So we're going to anchor it and start from the outside and work our way in.
Okay. So, when you get the blood, you want to make sure that the color and consistency is okay. There's no black bubbles, spots, that kind of thing. Just converting a few times. Nice.
Okay. So now that the dressing is off, I'm just going to inspect it for cocoa. So I'm going to look for color, odor, amount, and consistency. There's none noted on here, so I would be able to throw it away in the garbage. But if I had some sustainable drainage, I would need to put it in a biohazard bag. So now what I'm going to do is I'm just going to inspect. I'm going to see if there was a stabilization device in place. And I'm just going to inspect the catheter, make sure it looks okay from here to the insertion site. So now what I'm going to do is I'm going to remove my gloves. I'm going to wash my hands.
Blood type is B positive.
B positive.
Donor pool number is 7890.
7890.
Units in pool, 4 units.
4 units.
I'm going to
50 ml.
don my sterile gloves.
Blood component.
So is it okay if I use this end of your bed here?
Yep.
Donor blood type O positive.
Okay, so this is sterile, so it's going to be important that you don't bump me or anything, okay?
Okay.
Date 1, 2, 3. Alright, perfect. So we got some matches.
I just need to make sure to not turn my back to my sterile field.
Blood band number matches the 456654, which it does, so we're good there. I'm just going to do a quick little assessment of lung sounds, that kind of thing, grab a set of vitals, blood pressure, pulse, respiration, O2, temperature, and we'll take a quick listen to your lungs. I have too much to do tonight. Have you done the discussion here?
I'm not going to talk. Okay, so now what I'm going to do is I'm going to
Here. Gloves on. We're gonna pretend that didn't work. I'm sorry, I looked it up. So now what I want to do is just get rid of all my supplies. So I'm gonna take my tubing out of the bag.
put it in there. Drop these here. So now what I'm going to do is I am going to, with my sterile, here I'm going to just hold this up, and I'm going to clean by the insertion site in a circular motion.
Make sure that if there was a solution running, that would be compatible.
Again,
but it does not
in a
have solution
circular
running.
motion.
The only other thing that is compatible with PICC red blood cells is normal saline.
Again,
I'm just gonna check the expiration on
circular
normal
motion.
saline. We are good until 2021.
What I'm going to do is I'm going to take this. I would activate it, and then I'm just going to vigorously clean all around the insertion site. Pause here about 30 seconds. Okay, then now I throw this away. Now what I'm going to do is I'm going to take off my sterile gloves. I'm going to wash my hands. Take this. I'm going to line up my pick in the center of the dressing.
What I'm going to do is this is sterile yet, so I'm just gonna lay this here with the cap on it. And I'm going to do a flush of my IV.
Okay, and then with my little extra piece here, I would put my name or my initials, the date, and just that I would change it. I'm gonna just use this to secure the tubing again here at the edge. Then I would take my supplies, throw them away. My hands. So if I was doing some modifications again across the lifespan, is I'm just gonna take a mask here. If this was a kiddo, it might be good to have a parent there, just because it can be kind of scary, or show them the tools, let them see it, and just be cautious with older patients because their skin might be more fragile. So then I would clean up all my supplies, and I would side rails up, make sure the client was safe and comfortable. I would then document the time that I changed the dressing, if there was any drainage on the old dressing that I removed. I would document what the insertion site looked like, and everything like that. Then before I leave, I will wash my hands. And do you need anything else before I go?
Nope, I'm good. Thank you.
Okay, awesome. Thank you.
Wow.